In the United States, Hep C is still a major problem, and we are not meeting the WHO elimination goals for hepatitis C as a country. Here in Cherokee Nation, our final goal is to be able to test and be able to give them the medications on the same day.
So Cherokee Nation Health System is located in northeastern Oklahoma. Our main campus is in the Tahlequah, Oklahoma area. We have nearing 500,000 citizens of the Cherokee Nation right now. I would say well over 150,000 of those are residing here on the Cherokee Nation Reservation, which spans 14 counties and over 7,000 square miles of property across northeastern Oklahoma.
We're here to support our communities, here to do everything we can to build up our communities and take care of those patients that are eligible for our services. We're in a very rural area, and we've looked at different ways to overcome those challenges over the time that I've been in this job and even before me. And for the most part, we're trying to find ways to meet people where they're at.
So when you're trying to eliminate hepatitis C, the most common pathway is a patient comes into your health system. You screen them for hepatitis C, regardless of risk, and then if their antibody is positive, that gets reflexed, with good luck, into an RNA. Sometimes you have to get the patient back again, draw blood again, and send that hepatitis C RNA to be done. So it takes, traditionally, several weeks to months, depending on who you work with. The problem with that's going to be fine for 75% of the patients. But there's 20 or 25 or more that will not come back for those multiple visits. And it's usually social determinants of health. And if you don't address them, you're not going to eliminate hepatitis C, and the most vulnerable ones will not access the healthcare that they deserve.
The epidemic of opioids was hitting us pretty hard. I started to see it back in the early 2000s in my role as a child welfare specialist, seeing these families that we're working with, and we did not know enough about what they were struggling with to really help them. So we started looking at harm reduction. I know Dr. Mears' team has been looking at it for a while, and when we started getting involved, we had a really great relationship and partnership with the Eastern Band of Cherokees. They had been doing harm reduction for several years by the time we got down there, and the things that they were doing for harm reduction were mind-blowing. And so our task force, we formed that back in 2018 and started really working with Dr. Mears' team, with public health, with our partners within the tribe. And so our tribal council was able to pass legislation for our tribe to get harm reduction services to be, first of all, legal, to do syringe service programs, and then that's something that helped us launch it.
Harm reduction is about treating the whole patient, body, mind, spirit. It prioritizes keeping them well today versus coercing them into treatment and recovery.
The members are the ones that are not quite ready for recovery. They can't focus on anything because that addiction has got a hold of them so badly that they're not able to even meet their most basic needs. When you bring in a harm reduction program that does not cause drug use, that drug use is already there. When you're bringing a harm reduction, you're bringing a bridge for people to cross over when they're ready for recovery.
We have a unique position here because we're so close and so integrated with our health system. When somebody is ready for it, we have the ability to fast track them over to treatment.
So once we got the harm reduction legalized, Cherokee Nation was an early adopter, and they set up a program. And coincidentally, a year and a half later, the point of care RNA appeared, which had been in Europe for years, and I was always thinking, why don't we have that test?
Any kind of testing that we provide, if we're able to capture something in a visit and not have to have the patient come back later or another visit to get what we could have gotten on the first day, that's what we're looking for. So when Dr. Mara came to me and was like, hey, what do you think about this idea? I thought it was fantastic.
So we put a machine, a gene expert, in the harm reduction site, and it's been very successful there because now patients are coming in and we can test them on that same day and just make decisions on treatment.
So we went from a process that could take 6 months down to a process that took 1 day.
Having the Cepheid test and being able to tell a patient that same day yes, you have hepatitis C, yes, you need treatment, or no, you do not have hepatitis C and you don't need treatment, was just a game changer.
Since we started with the point of care RNA, 70 to 80% of the patients who've tested positive in the harm reduction site have initiated treatment. And that for us, it's amazing because these patients probably we would never see at all in the clinics. Our next frontier is to go to community events, go to other clinics, pair our mobile unit with the harm reduction unit in the community, and I think that's going to be very successful. So being able to meet the patients where they are, it's critical for elimination. So now we have a place to find the most vulnerable population for hepatitis C. And now we have a test that on their site we can confirm that infection and provide them treatment.